One of the things that I've noticed after years of doing this work is when I'm starting to work with addiction and the client comes in the first time, I usually hear their story. And with their story is a lot of history. A lot of times the referrals will come to us from the court system or through a medical doctor that we work with that knows that we specialize in what we do. And they'll send them to us, send the addict to us, and as we're starting to work with them, we realize that for years they have been misdiagnosed often. Someone who's bipolar will say they've got ADD. Someone who's OCD is labeled hypervigilant, and they get all sorts of meds. The meds are experimental. Everybody's trying to do their best with them, but they haven't yet hit the mark. So when Greer and I talked about our process and our program, it was what happens when people come in and they are labeled the addict, and then they have the addict victim mentality, and then from there they use addiction as a placebo of why they're not all right. But we see everything from borderline personalities, a lot of bipolar tendencies, all these other things that are going on. And what do we do with that? That's what Greer and I talked about. And the beautiful part about it was that no matter what people have in their behavioral issues, with their behavioral issues, is that our program will help all of it. We didn't expect that. We weren't really looking for that. But if they incorporate our program with whatever is going on, it will help the addict themselves be able to describe what's going on to the medical professionals and other forms of therapy so much more real, because they're going to be more in tune with themselves and they will get a much more accurate diagnosis. There have been so many times when I try and work with a team. I try and have a medical doctor, possibly another, a psychiatric nurse, people that I know in my community, and now because we travel a lot in other communities. And I always say it's really nice to have a team working with an addict rather than just one person. If the person's only been to one medical doctor and has got no other opinions, often there's a misdiagnosis just because they buy into the first thing that they're told they have. They create that label and they say, oh, I've got this. And what I found is often with a team effort, we can get a much more accurate prescription for recovery. And then when you bring our process in, the addict themselves has a lot better chance with their coping skills, more articulate communication, and a much higher form of education about what is actually going on. So it's a great process, and misdiagnosis happens a lot. I'm glad that we're able to narrow that down some.